Lakshman. I am a public health specialist and the founder of AddressHealth. Today I wanted to make this video to talk to concerned parents about this new Omicron variant. I've been receiving a lot of requests from schools and parents saying, we're really worried that this new variant has come and what is going to happen, our children should not go back to school, etc. So I thought, let me clarify a few points that are already available in scientific domain, and let's try to explain that. This new variant, right? It's not like, this virus is mutating and other viruses have never mutated. This is because we have increased scientific awareness and we are doing the genome sequencing of every single possible country is trying to contribute to study these mutations, because this virus has definitely affected the whole world. So because of this, we are able to spot this mutation much ahead of time compared to, say, in the past. Now, what all viruses tend to do is typically they tend to mutate for self-survival, and for self-survival they have to become more infectious, more transmissible from human to human, but less severe, so that they don't cause severe disease or death, because the longer they are in human beings, longer they cause symptoms, more they are able to transmit to others. And early indications from South Africa indicate that this has been the case. The virus seems to be causing milder illness and is transmitting to many more people, and that is resulting in an increase in cases in South Africa, especially in Gauteng province. But the hospitalizations and the deaths are not going to the same kind of, not rising along with this new variant. So this shows that this kind of information is clearly demonstrating that it looks like this virus is likely to be much more milder, causing much more milder disease. Now, things with regard to children, nothing has changed as of now. Children have less severe forms of COVID because, of course, of many reasons. Previous coronavirus infections, they have less AC receptors, etc. Nothing has changed in that context for Omicron to have any serious impact on children. So children should continue schooling, should continue to lead as much as possible normal life. The pandemic has destroyed children's lives they have paid a far greater price than the rest of us as adults have paid, and we need to focus on the information and data and what it means and not panic based on some interpretation that are being given by various people. More on this as data comes. Thank you. I had said I'll provide an update, and here I am with an update. Discovery Health, a very large insurance provider in South Africa, has come up with a very good scientific real-world evidence update, which I want to share with all of you. Of the many things that they talk about, with more than 200,000 people, records that they have examined of COVID-related tests, vaccination records, hospitalization, etc. In relation to children, they find that a very small actual number of admissions are needed even in the current Omicron variant, although it is 0.2 times more than the children who got admitted in the first wave. But interestingly, what they find is this increase is also because of the hospital policy now to test any admission, even a child being admitted for any reason, being tested, and they are finding that these tests are resulting in a COVID positive result, which is very possible when there is a very highly transmissible variant going around in the community, and these children may be incidentally being detected with this particular variant of COVID. But doctors are finding in South Africa that mild 3-day illness in children are being reported. Nasal congestion, sore throat, fever for 2 to 3 days, and most of them are getting better that way. So this is the real world evidence data that we want to share to demonstrate that whatever we know of Omicron today, it seems to be going on the path that it seems to be milder, and children have no specially additional risk of COVID due to this variant. More when we get more data. Thank you.